Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked question. What are three words others would use to describe you? Or the similar question as what does your mom say about you? So actually this for these questions, it's pretty easy to answer. And we can always use the answer for what are your strengths to this question. And but be careful, the interviewer here asks us three strengths, so need to tell them we need to tell them three of our strengths, and in each strength we need to give them a short story to explain it, and also be careful of the time, no more than 1 minute for each strength, because you don't want to talk about too much about that, and in case you distracted the interviewer, or if the interviewer lose the interest in your topic. And for the young applicant, I would suggest you tell anything you think you have. You can tell them whatever you want to see. You have any restrictions. And for the older applicants, I would suggest tell them at least one of your leadership, mentorship, or teamwork. Also, you are not like a young applicant, so you definitely should have some experience in this area, and you want to let the interviewer know that you can definitely work with your future colleagues without any problem. You can, or you can just teach them, or you can help them on those clinical knowledge or skills. Just make sure that add at least one of these characters in your answer. And here's my answer. Okay, Dr. Cui, can you tell me uh, if can you describe three words that other people would say about you? Yes, definitely. So I think the first word would be conscientious, because whenever I saw a patient, I always try to make sure that our medication or treatment plan won't cause a second damage to my patient. I would always try to see if there's any contradiction for those medication or treatment plans. So that's why I would say the first word is as a conscientious. The second word, I would say that I'm good at time management. For example, when I was doing the residency training in China, I did pretty well in clinical training, and simultaneously I also did pretty well on my research. I applied 5 grants, and I also got 3 patents. So you can see that I'm apart from the clinical training, I also did a lot of research, and published many papers and got a lot of achievements. And the third word I would describe myself, other describes me, is I think it should be the good. I'm good at teaching. Um, I'm a good mentor as well. Also, when I was in China, I led a research team, and whenever my students have questions or problem, I'm always trying my best to help them and inspire them to solve those problems. And also I guide them how to do the research, how to apply those knowledge to the clinic, and finally we published many papers. So I would say that I would say so. So that's why my friends or other people told me that I'm also a good teacher. So I think that's all the three strengths, three words that people describe me. Okay, so you can see that in my answer, I mentioned that I'm good at, I'm very conscientious to my patient. I pay a lot of attention to those details, which is good. And also the second one, I'm good at time management. So I have experience for the residence training in China, and also I did pretty good in my research. So the interviewer probably will think that I can also do well in the future in their program. So that's also I think that's also a good answer for for the interviewer. And the last, I mentioned that I'm good at teaching, and I'm a good mentor, and the interviewer probably will think that I can also teach their medical students, so if I can join their program. So that's all of the answer I can give to you. So hope you will also do well in your answer. Good luck.